Hi everyone, my name is Jada, founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers like lactation consultants, doulas, and mental health therapists. So today I want to talk to you a little bit about how do you know if you need a mental health therapist, what's going on with your mental health, especially, while pregnant or postpartum. One thing to know is that if you have a history of depression or anxiety before you got pregnant, then you are at higher risk of experiencing either prenatal depression or even more so postpartum depression or anxiety. So great tip if you're pregnant right now and you're feeling fine and you haven't been in touch with your therapist in a while, but you have experienced it in the past, is just to make contact, with your therapist, or at least know that they're practicing, or if they're not practicing, start to find out some other resources for other therapists in case you need that support. Of course, at Boober, we do match people to mental health therapists who specialize specifically in pregnancy and postpartum. And so in some cases, we don't need a whole lot of therapy. We just need somebody to talk to and normalize or express or explain what is going on with us so that we can actually start to heal or get better or get diagnosed or get treatment, which might include anywhere from therapy to medication, whatever it might be. Right? So in postpartum, there are two things we need to distinguish. There's the baby blues, and then there is what we call the PMADs, or postpartum mood and anxiety disorders. And if you are experiencing baby blues, typically we talk about that as happens in the first 10 to 14 days. It's hormonally driven, right? We just gave birth and all of our hormones start to crash and be built and crash and be built. And we are having such a big stew and soup of new hormonal existence that we may find ourselves looking at our baby and smiling and feeling such joy, and then all of a sudden looking at our baby and finding the joy turning into sadness and tears, and then just feeling overwhelmingly sad or down or crying, which then may turn back into laughter or up. So it can be kind of up, down, all around. And that's normal. If you're feeling not like yourself, or it's getting more persistent, or it's lasting really more than, we say 10 to 14 days or so, that would be one sign that it would be time to reach out to a therapist. Then we have postpartum anxiety or depression can come up anytime really in the first year. And most people just talk about postpartum depression and we don't hear as much about anxiety. So it's kind of, we look at it in all the categories, but to recognize if you are not feeling like yourself, if you're feeling like things that used to bring you joy are not bringing you joy at all, if you're feeling disconnected from your baby, like you're not really wanting to connect physically or emotionally with your baby or your partner or your friends or anybody. If you're starting, that can be some of the signs of postpartum depression. Postpartum anxiety can manifest like maybe you're not sleeping, you're starting to Google things all night, you're really worried about the baby, so that you're checking on the baby really more frequently than you know feels normal. Like you're checking their breathing so much that you aren't able to go to sleep at all when they're sleeping, and you're starting to slip into a pattern where you've slept less than 5 hours in a whole 24-hour period. The less sleep we get, the more anxious we can tend to get, and that's why sleep is so critical. And we talk about this idea of sleeping when the baby sleeps, but it's easier said than done, and sometimes our partners need to recognize that in us, that we are not doing that, and then we need to take the next steps to do whatever we need to do, which is maybe having somebody else care for the baby. Maybe it means that a bottle needs to be given so you can get some extra sleep, even if we've said, you're working on building breastfeeding. Maybe it means that you need to make an appointment and talk to somebody, or starting by telling a close friend or family member or Boober, us, even if you don't want to book an appointment, we can connect you to somebody to screen you and talk to you. So know that postpartum depression and anxiety is actually highly treatable if you can tell somebody that you're not feeling normal, right, or you're just really, really off. And so we are here for you, to reach out and to be there for you. Thank you.